Cheryl Galvez, and I've been with Dr. Noah. I've been with Dr. Noah for over 20 years.
And I'm only 10 years old.
Yeah.
How that works.
But I know that since I started doing the natural medicine with Dr. Noah, that my health is a lot better. I'm healthier now than I've ever been. My asthma is far in between, and
We used to go to the hospital, didn't you? Used to?
yeah, recently,
Yeah.
well, not recently, a couple of years ago, they put me in the hospital for some kind of obstruction. They couldn't figure out what it was, and they pumped me with full of chemicals, and I ended up with a acute asthma, and I came to Dr. Noah, got myself on a natural regimen, and I haven't had that kind of an attack since. And I haven't had to have antibiotics of any medical doctor chemical antibiotics in that long, probably 3 years. So I'm a lot happier.
Well, also tell your story about when you did go, because you occasionally have to do some things with your medical doctor because you have to do some tests and stuff that we requested and stuff like that, where he kind of remembered who you were about, oh yeah, you're one of those that like the natural things.
Well, I did it years ago. I had a problem with one of my thumbs, and so I had the cortisone shot. And as soon as the cortisone, because I don't have chemical medicine in my body, as soon as the cortisone hit my bloodstream, I started just crying and crying and crying and crying. And it was some kind of a reaction to it. So I told the doctor when he wanted to give me cortisone again, I said, I'm not taking that cortisone because of my reactions to it. And this recently I went to see him about my osteoarthritis in my thumb, and he was trying to talk me into either taking some kind of pills, which put me in the hospital in the first place, or the shot. And I just simply shook my head lightly. And
I do like what you did to me.
Okay.
Yeah, you like that.
I had my hand like this, and he said, we need the pills. And then by the time he said, or a little shot, and I went, and then he chuckled and realized, oh yeah,
you're that
well
way.
then we're just going to have to ice it and not use it. And I go, sounds like a plan.
Exactly.
And I will see Dr. Noah because I'll have my x-ray.
Yeah.
And we'll know exactly what to deal with, and that's what we do.
And now your thumb's getting better.
Yeah, it is a lot better, especially since I started taking the Protandim.
Right.
And I take the Curve Flex, which the other day, for a couple days, I had stopped taking my hands started to hurt a little bit more.
Natural anti-inflammatory without any type of side effects like liver damage, kidney damage.
Exactly, or any kind of reaction to it.
Yeah, exactly.
Except for less pain and less swelling. My swelling went down. So I'm much happier where I'm at right now.
Also, we'd just like to show, and this is a credit to you, Cheryl, for your dedication in terms of your hard work. This is what Cheryl used to look like. And then with her, once again, hard work, because that's what health is. I mean, I'm only like a coach, like a teacher. My patients have to do some of the work like that. She's gone from over 300 pounds to last time, I don't know if you want to talk about, but...
I'm in between the 144 and 146, but I'm working on...
150, 160 pounds. That's
I'm working on getting down to about 120.
And that's how much I weigh. So you actually had me on your back for quite some time. Now I'm off your back. Yeah.
But in that aspect, my blood pressure is back to normal. My blood sugar is normal. I found doing the cleansing, the cleansing here, I was able to find my food allergies that I'm able to stay away from, and that has helped me in a great deal of staying healthier as well.
So what are you sensitive to?
I'm sensitive to all of these sugar substitutes that is not natural, meaning I can't have a stevia or truvia, those kind, but Splenda is out. I had a horrible reaction to that. I am allergic to milk, cow's milk, and I also have a reaction to pineapple that I did not know I had because I was all eating all those foods and
yeah, and even though they're kind of good foods for some people, for you, it's not good. Just like some people can eat peanuts every day, some other people, they eat peanuts, they die.
Yeah.
So it's not the food, it's your unique characteristics that make you sensitive to certain foods. So
Exactly.
you find that out, and lots of good things
You
happen.
know, however people look at me as being, you know, oh, it's your diet. So usually they say, it's not my diet, it's my health.
Exactly.
So I stay away from those things, and it's keeping me healthy.
Bravo to you, Cheryl. Thanks.
Thank you.